It's been quite an exciting journey that we have been going through. As you have heard, I'm coming from very far away from Zimbabwe, and it was quite a difficult process for me to be here. I think I was left with 2 days before the conference starts, and still I had not managed to get a full visa for me to get access to Costa Rica. And it was a point whereby we were almost thinking of saying, guys, let's just give up on everything here. But the faith in me said, you know what, you need to continue pushing. And I spoke to Jack, I spoke to Chip, I spoke to Josh as well. And it was very difficult for everyone to say, okay guys, should we continue or should we not? Because of the cost and the expenses for me to be here. But they all supported and they all said, my one, just keep trying, push, and we'll see how far we go. So I traveled to Kenya, where I finally got my visa to be able to be here. And when I was in Kenya, God did miracles. In the same day, which was on a Tuesday, that's when I met with the Costa Rican embassy in Kenya. I got the visa. In about 3 hours, I had the visa stamped on my passport, ready to come to Costa Rica. God did amazing things. One thing that I want to share with you today is that perspectives are very important. Perspectives are very important. If I just take this piece of paper that is right here, and I ask Mario, can you see what I'm holding here? I mean, just see what I'm holding in general. What am I holding? Okay.
I'll hold your tag.
All right, a name tag, right? So, can I ask you to come closer? Can I ask you to come closer? Just read what's written here. All right, awesome. So, one thing that I just want to say about perspective is that, perspective, beloveds, is that it's important to get closer to see perspectives. So it was also very important for me to come closer, being here in Costa Rica, to see things clearly, how things are happening and how things are going on. Even for Jesus to come here on earth, it wasn't to change his perspective about us, but it was for us to change our perspective about him and about God. And I believe that's God's desire for all of us to say we should have the right perspective of who God is. And it was also important for me to have a clear perspective of what Christ for the City International is all about, from the Costa Rican perspective, from the Guatemala perspective, from Argentinian perspective, from the Colombia perspective. It was very important, and that's one thing that I'm really appreciating about being here in Costa Rica at this moment. And it is actually a priceless, experience for me to be here, just as much as it was a priceless experience for Jesus to come down from heaven and be here on earth, for us to experience God in reality. Are we together? So this morning I just want to share with you briefly of what has been happening in Zimbabwe. So with the work that we are doing in Zimbabwe, we have been mainly looking at our hospital ministry in Zimbabwe, our prison ministry in Zimbabwe. We have also been reaching out to young people and to children in Zimbabwe. Our hospital, system in Zimbabwe is quite crippled at the moment. There are many challenges with the hospital system in Zimbabwe, and as Christ for the City Zimbabwe, we have seen it as a great opportunity for us to be able to manifest a perspective of Christ through the ministry that we are doing. So as Christ for the City Zimbabwe, we've got 3 volunteers that are doing wonders in the city of Bulawayo, which is the 2nd largest city in Zimbabwe. So we've got 3 volunteers who are ladies and who are very passionate about changing lives. And these are ladies who are not looking out to be paid for what they are doing, but they use even their resources to go out and reach out to people in the hospitals, to reach out to people in the prisons, and to reach out to young people also who are going through difficult situations as well. So the report which I'm showing you is basically out of the work that is being done through the work of these 3 volunteers and through the support also that is coming through from the CFCI family here, who are actually gathered here. So what we have been doing, we have been able to do hospital ministry, and our hospital ministry is mainly targeted towards the mental health hospitals and also the general hospital. And as CFCI Zimbabwe, we have managed to adopt one of the wards at one of the biggest hospitals in Zimbabwe, which is called Mpilo Hospital. So the ward which we have adopted is a ward that actually looks after patients who are affected by HIV and AIDS illnesses. So through our visitations and our hospital ministry, our volunteers identified this ward as one of the greatest wards that has got the greatest needs, because it has got patients that have been neglected, some of them by their families, and some of them they are not getting enough medication from the hospital system. So we come in as Christ for the City International to help out with medical needs for these patients, to help out with also toiletry needs for these patients, and to also help out with the spiritual needs for these patients. And we have also identified another mental health ward in the city of Bulawayo, in a hospital that is called Ingucheni, which is one of the largest also mental hospitals in Bulawayo. And we have also adopted a ward in this mental hospital which has got great needs for the mental health patients who are actually admitted there, which includes their clothing, which includes their food as well, because there isn't enough food that is available, and which also includes medical needs, because there is not enough medical supply to help with patients that are actually affected with mental health in this ward. And we also assist with spiritual needs, and also we are in the process of coming up with a support group that is also targeting to help families who are dealing with mental health patients within their homes as well. So we did a donation recently towards the mental health patients at Ingucheni Mental Health Hospital. And what you can see here, these are slopes. So most of the patients actually at Ingucheni Mental Health Hospital, they're actually walking barefooted. They won't be having anything to wear on their foot, and some of them won't actually be having anything to wear, even in terms of the uniform which they are supposed to be wearing in the hospitals. So as Christ for the City Zimbabwe, we have managed to buy 174 pairs of footwear to assist with patients, and this was through working together with the CFCI family, with the donations that are coming through the CFCI family, and this has gone a long way in helping the patients. So what you are seeing here, we were together with staff at the mental health hospital, and they greatly appreciated this great initiative that is coming from CFCI. And these ladies that you are seeing, this is one of our volunteers. Her name is Sister Nandi, and this lady as well is one of our volunteers. Her name is Mrs. Dube, and this is one of our volunteers as well. Her name is Mary, and these ladies, they work tirelessly. They actually go to these hospitals, our mental health hospital and our general hospital. They do 2 visits to both of these institutions per week. And they will be basically ministering to patients that have got great needs, and they help us to keep identifying those patients who have got serious and great needs, and any other needs that the hospital itself has got general needs towards taking care of the patients. Another initiative that we did as Christ for the City Zimbabwe is we also went to our general hospital, which I've told you is Mpilo Hospital, where we have patients that are affected with HIV and AIDS. We made a donation for toiletries to the patients that are affected with HIV and AIDS. So these patients, some of them will not be having